I don't actually have any, do you? No? Look like we're almost fairly full. Take those off. Minutes of the previous meeting. You've been sent, yeah, everybody's had this. Yeah, you were sent a new version of the minutes. There were a couple of typing errors which have been pointed out and corrected. So the new version, could I just have agreement to sign these?
Agreed, Chair, as long as my name's included on the members' attendance.
Okay, that's Councillor Hunter and Councillor Dodd, yeah? Right, disclosure of members' interest. Does anybody have anything to declare that's not already on their declaration or anything they want to point out? No? Very quiet, right. Move on then, forward plan. You've had a copy of the latest forward plan. There's nothing that I can see that's of relevance to this committee. So unless anybody's got any comments, we'll just move on. Yeah? So item 5 is the Health and Wellbeing Board. We've got the minutes of 3 separate meetings, the 10th of November 22, the 8th of December 22, and the 9th of January 23. They're attached. Is there any issues that you want to be considered or thought about or discussed later? No, you're all happy with those. Right. Report to the Director of Adult Services. And we've got the North Tyneside and Northumberland Safeguarding Adults Board annual report for 21-22. It's on pages 41 to 86, and we have Paula Mead, who's the chair of the Safeguarding Board, and Karen Wright, who's the service manager for Safeguarding, who are going to present this to us today. Yeah, thank you.
Thank you, Chair. As Chair said, I'm the independent chair of the Safeguarding Board. It's actually at the moment it's an integrated children and adult safeguarding board. However, the report that we've brought to scrutiny today is obviously from last year because it's the annual report, and it sets out, as is our statutory duty to do so, what we have done in relation to the safeguarding system in Northumberland and North Tyneside. Clearly today we'll be focusing on Northumberland, and it sets out what we've achieved, what we need to achieve going forward, whether there are any safeguarding adult reviews and learning from those reviews, and it also sets out what we're going to do going forward. The arrangement with North Tyneside, which I think we've probably explained in the past at various meetings, that has now finished. That finished last year. We were a joint board with North Tyneside, and both areas, both local authority areas, came to the conclusion following a review that we would be better place-based, and so therefore we separated. The report will reflect what happened during that period. This year we've spent the year, just so that we talk a bit about what's happening going forward, we spent the year integrating the Northumberland safeguarding adults element with the children's safeguarding element, and that's so therefore in essence this will be the last report of the Northumberland and North Tyneside's adult safeguarding report. So I'm, as I say, it's a statutory duty on the local authority to set up a safeguarding board, and the partners have a duty who are responsible for maintaining the safety of adults at risk to contribute to this report. So it is a multi-agency report. It's not a local authority report, just to be very clear, and it reflects that within the information in the report. Karen's going to go through the detail of that because she's the author of the report and she knows it inside out. So if anybody has any questions at the end, we'd be very happy to answer those, but I'll hand over to Karen now.
Good afternoon. I'm Karen Wright. I'm Senior Manager for Safeguarding Adults. I manage the strategic side of safeguarding. So as Paula says, this annual report evidences how the Safeguarding Adults Board meets its statutory requirements to prepare and publish an annual report. So this is a public report. This will be published on the Safeguarding Adults website and fulfills our duties under the Care Act. So I'll just give a very quick summary and some highlights from the report. So the report sets out the operational safeguarding activity for the year. It describes a range of improvements in safeguarding arrangements and how we work with our partner agencies to improve safeguarding arrangements for vulnerable adults at risk. So in terms of safeguarding activity, following on from significant increases in safeguarding activity that we reported last year, Northumberland continued to experience increases in safeguarding demand. So the Northumberland safeguarding data shows a 38% increase in safeguarding concerns and a 6% increase in safeguarding inquiries compared to last year. Safeguarding inquiries are those investigations and inquiries we're required to undertake under the Care Act when the criteria for safeguarding adults is met. The main location of abuse during this year was recorded as within people's own homes, although and that was quite significant last year in terms of recovering from COVID. A lot of people were still in their spending the majority of their times in the homes, but this year we have seen an increase in safeguarding reports in relation to nursing and care homes, which would correlate with restrictions being lifted and a business returning to usual and people, professionals visiting services. So in terms of local trend, there's been a continued increase in domestic abuse. I think I reported last year quite a significant increase in domestic abuse, which caused quite a lot of concern, but actually that was a national and a regional trend that we observed during COVID. So we've continued to see a rise in domestic abuse, but not in the levels that we had done previously, and we have seen an increase in self-neglect. So a key focus of the board this year has been to understand the impact of the pandemic. So we have obviously come out of the pandemic and recovered. The recovery has taken place, but there's quite an impact, a lasting impact in terms of safeguarding adults. So the board has been able to, by analysing the information, we've been able to respond to changing safeguarding needs and identify lessons learned, which has directly informed future planning and priorities. As I talked about, an example of this would be in terms of self-neglect. It's evident that individuals have delayed requests for help and support, which means that often their presenting needs are much higher or much more acute than they've been previously. So one of the things we've done in response to that is we've been involved in a regional campaign around self-neglect, one to raise awareness of with the public around what self-neglect looks like, but also to provide some guidance for practitioners in terms of how you deal with self-neglect. So there's been a production of some 7-minute guides for practitioners, but also we've published an animation for the public so that the public are more aware and so that we can intervene and support people at an earlier stage. The MASH, so the Multi-Agency Safeguarding Hub, that continues to be a strength for not only the local authority but the multi-agency partners. It continues to provide an effective multi-agency response and a holistic assessment of risk, and that's always been a strength in Northumberland. And last year there was a review of the MASH. The report sets out the board's response in relation to 5 key strategic priorities, which are documented in the annual strategic plan. Again, that's published on our website, and that's a statutory requirement that we need to formulate and publish a strategic plan. So this plan has been formed by local safeguarding data, experiences and feedback, and also self-assessments and regional priorities. And the priorities are around the impact of COVID, transitional safeguarding arrangements, domestic abuse, criminal exploitation, and making safeguarding personal. So the report sets out some key work that we've undertaken in relation to all those priorities. There have been no safeguarding adults reviews undertaken in Northumberland this year. Again, another statutory duty of the Safeguarding Adults Board. However, we have proactively undertaken a number of learning reviews so that we can consider any learning, even when the criteria for a safeguarding adult review hasn't been met. And learning from previous local SARS and safeguarding adults reviews and learning reviews have continued to be monitored, and action plans have been completed. As Paula said, this will be the final annual report of the North Tyneside and Northumberland Safeguarding Adults Board. Following an independent review, there's been a decision to pursue place-based arrangements, and since April last year, we've been operating as an integrated partnership, and a new full model will be launched this year in April. So next year we will be producing a joint annual report with the children's side of the partnership. I hope that was helpful. I'm happy to take any questions.
Thank you very much. Thanks. Councillor Dodd.
How do we stack up on the figures that you've, up 20%, up 30, at the start of the presentation, you were saying everything was up. I mean, I know that it's still the tails of a pandemic. Where do we sit with those figures up into other similar authorities? Are they all up? Is the whole country up? Or are we a blip?
Yeah, so this is something that we do monitor closely. So we have a regional scorecard. So we compare ourselves on a quarterly basis with other local authorities in the North East. There's a national return where we can look at how we can compare nationally. So we do know that these themes are themes across the board. So the rise in domestic abuse, the rise in self-neglect, these are themes that all areas and all boards are dealing with. A lot of the priorities that our board has are the same priorities that other boards have nationally and regionally. Sometimes it's difficult to compare, but particularly regionally, we've got quite a lot of similar profiles, so we monitor that quite closely.
Thank you. I think that was a fear at the very beginning of the pandemic, wasn't it? Which has proved a big...
Yeah. And we were part of a national project during COVID, the National COVID Insights Project, which tracked our data with national and regional data, and we received quarterly reports in relation to that. So throughout the pandemic, we were able to track if we were in line with other themes and trends. We had a SAB risk register, which any things that we were concerned about were monitored via that risk register. So we've produced a graph which actually shows Northumberland in terms of in terms of data, and a graph in terms of where we are against regional and national, and I think that's within the report, just to give you an idea of differences. There will be some differences, there always is. Demographics will ensure that there will be differences, but we need to ensure that those differences are not we're not outliers, and where we are outliers, then we will take action to look at our systems and processes.
Thank you. Councillor Hill, and then Councillor Hunter.
Thank you. Just digging behind the figures a bit as well. In terms of the location of abuse, there seems to be an emphasis of 69% inquiries were about abuse in people's homes, and 11% were in nursing care homes. What are the obvious question is what percentage of adults are in nursing and care homes? I'd hazard a guess that it's less than 11%.
I probably do. I don't
So therefore, because and it's really, you've got to couch the language really carefully. It's important to not make any sweeping statement. But I do get a lot of residents concerned about care homes and neglect in care homes, and awful when you're hearing about people's mothers and fathers and so on who are being assaulted by other residents in care homes, and actually in some cases with obviously complexities around dementia, being both physically violent themselves and also a victim. So I just would be interested in commentary about that, about the safety within care homes, because my guess would be that percentage would include as a proportion there's more complaints about what's happening in care homes. And just a second point on the stats, 91% of inquiries had risk identified and action taken. That is an encouraging statistic in the way, because we know how organisations culturally can not want to admit that there's something. So that seems a high percentage, but it also possibly suggests that, and it's not an easy thing if people aren't coming forward, but probably suggests there's lots of risks that aren't being identified with that high stat.
Yeah, but I think you're right. I think that is a reassuring statistic. I think sometimes the complex nature of safeguarding adults inquiries means it's not always possible to take action, and I think sometimes that's often down to the wish. One thing we're really strong on in Northumberland is making safeguarding personal and asking individuals what they want to happen, and often we can't take action because they don't want us to take action. So that sometimes reflects that that comparison. But I think the fact that in 91% of cases we've been able to identify a risk and take action, I think that is a reassuring statistic. And just to come back to what you said about safeguarding concerns in care homes, we take this really, really seriously. We always have. We've, you know, our safeguarding organisational safeguarding procedures have always been strong. Our safeguarding team spend a lot of time dealing with, and when I say that, it sounds like there's a lot of, it's a key focus for the safeguarding team and for the board. So during COVID, we undertook quite a lot of work around closed cultures and seeking assurances. So how can we seek assurances differently? How can we make sure that we're assured that in the care homes, even though people are not visiting, that we know what's going on? So we used other agencies. We linked in with the CQC, with commissioning, with other agencies, with you know, the kind of the community matrons, yeah, the people who were actually having access, and we worked with them very closely. The commissioning team do spot checks. I'm looking at Neil because Neil will be able to give you that information, but absolutely. And in terms of safeguarding, what I can assure you is that we undertake regular unannounced visits. So if we have a concern about a care provider, we will work really closely with CQC and commissioning, and then we will undertake an unannounced inspection, and we will review records and things. So that is, and that's a strength in Northumberland. That doesn't happen in every other area. Safeguarding teams don't always directly go into care homes, but we do, and we'd be able to evidence how many care homes we've been into this year, because it's actually just part of our usual practice in terms of looking into concerns about care homes. It's an area we take really, really seriously, and I think what our concern was in COVID, that we were seeing less numbers being reported, because often it's family members who will alert us to the concerns, and as we said, family members and professionals weren't visiting us often, so we needed to look at other ways we could share information, and that was a key area on our SAB risk register, wasn't it? We looked at closed cultures, we looked at raising awareness, and worked with care homes to kind of alert them to the signs of closed cultures and identifying them really early.
A very small quick point, I know others are coming in terms of, do you count abuse and take action when, because sometimes I'll have people who will say they're upset because they've gone in to see the mother, the father, and there's the sort of personal hygiene, the hair hasn't been done, they haven't changed the clothes, and that's quite upsetting for them. That's obviously not the most serious one. And then sometimes when you put that complaint in and then they come and see, they say, oh, well, when we saw them, you know, you can tell they've taken action. So that's why, you know, the spot checks, you do count that as a type of abuse if they're not having that personal. Yeah,
of course we do. It may not meet so that one isolated concern may not meet the criteria for a full safeguarding inquiry, but we will share that information with commissioning and contracts and CQC. We will record that as intelligence, so that's a picture that we're starting to build it. That may be an isolated incident, that may never happen again, but we may actually start to see that happening to somebody else in that care home. So we build up a picture in terms of, because that's where cultures develop, isn't it, when you have lots of different concerns. What we try to take is a really holistic view when we're we're looking at concerns, so we look at intelligence as well as what we're really we've worked hard on is looking at historical concerns, not as well as what's presenting.
Can I just add one thing? One of the, and this is sort of anecdotal, but one of the most distressing features of lockdown has been families and friends unable to see their loved ones, you know, in these environments, these closed environments. And some of the difficulty has been that perhaps over the year, or longer in some cases, family members will have naturally, if you like, deteriorated and become sicker and more frail and more elderly. And whereas if family and friends had been able to sort of see that process on a daily, weekly basis, it would be something, it is something that's natural, if that makes absolute sense. If you don't see somebody for months on end and then suddenly you see this dreadful, distressing deterioration, it's created a lot of heartache and difficulty for families. And I just, you know, I think we need to remember that's part of it as well. And it has been challenging for the care homes to try and, you know, maintain standards and staffing and health and safety. But I think all in all, they've done very well in Northumberland with that on the whole, just as an observation.
Councillor Hunter.
Thank you, Chair. First of all, a comment. It was interesting to read the case studies at the end of the report. That was quite interesting to read. Percentage-wise, it's like anything as a figure. You know, if we've got 10 cases, it goes up 20%. That's not a lot. But if you've got 100 cases and it goes up 10%, it's a big difference. My thought is, are we seeing the percentage increases because people are more open to reporting things? In the past, you know, it's more in the press now about abuse and different, you know, what's happening across the country. So I'm just wondering if the percentages is rising because people feel they now can come forward and report and they will be listened to.
Yeah, I hope that is the case. We've undertaken a lot of work to raise awareness, not just with partner agencies and professionals, but also with the public. We talked about the animation. We've also published another animation called Tricky Friends, which is about difficult relationships and how you recognise a friendly relationship and an abusive relationship. So we've done lots of things like that. We've also produced a safeguarding leaflet, which we published, posters. So we're trying our best to raise awareness because we want people to report concerns so that we can intervene at an earlier stage and kind of, you know, improve outcomes for people. So I really do hope it is. And we've got a really comprehensive multi-agency training programme which supports that, you know, and we've this year we have launched a suite of multi-agency safeguarding adults procedures that are all in one place and accessible to anybody who goes online. So the information is there at a fingertip. It's everything, all the information before you might, you know, they're in different places. It's a one-stop shop in terms of this is what safeguarding looks in Northumberland. This is where you can get help. This is what you can expect. Those types of things. So I really hope that is the case, and that will obviously raise awareness and it will raise alerts. And I think, you know, as long as those alerts, those concerns are appropriate, then we're really happy to do that. The other thing is that we do need to do a bit of awareness raising with partners around what constitutes a safeguarding concern, so we're not getting the wrong things through our system, and it's not clogging up our system with the, you know, so that we can focus on the really important work, which is targeting safeguarding activity for those people who really need it.
Thank you.
Derry, did you indicate?
Just to follow on from that, I noticed last year there was a campaign about domestic violence, and it was banners that you placed at schools, on the gates at schools, and obviously the parents who were dropping their children off could see these banners. A very good move, and I know there was a lot of response because of that. Are you going to be doing any campaigns of that sort in the future, where we're reaching out to our communities about the needs that you can address, whether it's domestic violence or whatever it might be? Are you planning campaigns in the future?
We are. So we're currently planning on, what I will say is that every year, annually, we take part in National Safeguarding Week, where we do lots of awareness raising with the public, with professionals, and we, which was what we did this week. So that's in November, and that's a standard. We always do that. We work with our regional partners to put on various events, raise awareness, produce lots of information that's shared with the public. We have a really strong, in terms of social media, in terms of the Facebook page, really raising awareness of these issues. We do have some specific work that we're actually planning at the moment around older people and domestic abuse. There's been a recent report by Age Concern to identify how hidden domestic abuse against older people is. So we've started to look really closely at our data around what that's telling us about older people and domestic abuse. So the Safeguarding Partnership is working now really closely with the Domestic Abuse Partnership, and we're looking to put together a public campaign to raise awareness about domestic abuse and for older people. Domestic abuse for older people can often look different and it isn't captured within the risk assessments and tools that we use traditionally. Domestic abuse for older people is often really hidden and not picked up, so we want to really raise awareness of that, and we need to adapt our assessment tools to make sure that we're picking that up and it's not hidden.
Any other questions? No? Very good. Well, in that case, I'll say thank you very much. It was really, really good, and I think you've answered all the questions. I think, we do look forward to campaigns. I agree with Councillor Bowman. So thank you very much.
Okay, thank you.
So item 7 on the agenda is the report of the Scrutiny Officer, which is the Health and Wellbeing Work Programme. Do you want to just take us forward, Chris?
Thanks, Chair. So the work programme for March has the update from NHS England on dental provisions within Northumberland. They came a few months ago, and I know certain members have had some more meetings with NHS England, but this will be an overarching sort of strategic view of access in Northumberland. And we'll also have the Director of Public Health's annual report, where Jill O'Neill will set out the stuff that Public Health have done over the last 12 months and their priorities for the coming year. And then in April and May, we go into the NHS quality accounts. So I will circulate dates of each of the trusts sort of after this meeting, but we'll have Northumbria, Newcastle, NIAS and CNTW presenting their quality accounts in April and May, and then we'll be into the next municipal year, where we need to sort the work programme out based on members' priorities and the areas that members are interested in.
Thank you. Pardon? Sorry. I've got Councillor Hunter, then Councillor Hard.
Somewhere can we slot in, which is what I raised at the December meeting, the ambulance service.
Yeah, I think there's going to be a lot of questions for the ambulance service, and I think it's that I'll be conscious when we put them in for the quality accounts, just to give them that extra bit of time for us to discuss some of the things that I think members will have.
In that case, Councillor Hill.
Thanks, Chair. Just following on from what Councillor Hunter said, at the last ambulance presentation, they did say they would come back with detailed breakdown of response times. I mean, he specifically in the response to our questions about Barrett, but I think other members would find it be quite interesting to get that. Well, it's vital we get that breakdown. It's obviously easily accessible. It's not asking for something that's... Hope that question won't delay them coming. But if we could have that before, that'd be great.
No, in that case, I'll move on to... I have no urgent business. Anybody else? No? In that case, the date of our next meeting is Tuesday the 7th of March, usual time 1 o'clock. So I will now, as I said at the beginning, close this formal public part of the meeting.